doing well. Welcome back. All right, good afternoon. Thank you, everybody, for joining us here for this press briefing on what the state is doing to slow the spread of coronavirus in Nebraska. We're back to our regular setup here today, so it's good to see everybody here. Again, we want to remind people that through the end of the month, we still have the old rules with regard to our directed health measures, which means a 10-person limit on gatherings. That would be through the weekend. We want to remind people all the same sort of hygiene things with regard to stay home if you're sick, wash your hands frequently, don't make unnecessary trips outside the home, work from home if you can, socially distance at work. You guys are not socially distanced, by the way. John, you got to step down 6 feet. Jeez. 6 feet distance between you and other people. When you go out in public, wearing a mask is always a good idea. Help kids, help seniors, exercise daily, all of our programs to be able to help make sure we keep Nebraska healthy. And of course, all the things that we're doing with regard to social distancing and all the other restrictions we've put in place through direct health measures is to preserve our healthcare system. And we've been successful in doing that. We've got 43% of our hospital beds available, 43% of our ICU beds available, and 77% of our ventilators are available here in the state of Nebraska. Also want to talk about Test Nebraska, testnebraska.com. Please sign up. We've got about 152,000 people that have signed up for testnebraska.com. We've done about over 350,000 assessments of folks, scheduled over 25,000 appointments and so forth. So please, this is a great way for every Nebraskan to help fight the spread of coronavirus here in Nebraska by signing up for testnebraska.com. And we are having those teams go around the state. And in fact, our schedule for next week will include Chadron, Alliance, Scottsbluff, Sidney, Broken Bow, Burwell, St. Paul, Valentine, O'Neill, Norfolk, Columbus, York, Lincoln, Fremont, Bellevue, and Omaha. So we've got lots of sites, lots of opportunities for people to get scheduled. Please go sign up for testnebraska.com. Also, yesterday we announced our plans with regard to the CARES Act money and our coronavirus relief fund. We had mentioned that we were going to be seeking an outside firm to be able to help us manage that. We've signed a contract with Deloitte & Touche to be able to help do that. We didn't have that quite done yesterday at 2 o'clock in the afternoon, but we are pleased to announce that Deloitte & Touche will be helping us with regard to the distribution of those the money from those programs. So thank you, Deloitte, for being a partner for us. So we've got a couple of guests today. The first is somebody who is not a stranger to Nebraska. In fact, he's been working in Nebraska for the last 2 months from his job in Washington, D.C. It's our former director for agriculture here at the state of Nebraska, and now USDA's undersecretary for marketing and regulatory programs. Got it right. Greg Ibaugh. And Greg, again, someone who's very familiar with Nebraska agriculture. We're very fortunate to have Nebraska represented at such a high level in the U.S. Department of Agriculture, so we're grateful that you're able to be here today. And Greg is going to talk about some of the programs that USDA has to be able to help our farmers and ranchers. Obviously, yesterday we talked about our program with regard to livestock, the livestock industry, and the $100 million we've set aside for that to help our small livestock producers with 1 to 10 folks in their operations. And Greg is going to talk about some of the things the USDA has been doing. So, Greg, I'm going to go ahead and call you up. Thanks.
Thank you very much, Governor. It's a pleasure to be back, and it's been a nice opportunity to come back and work out of the ranch and spend the last, since April 2nd, here doing my job every day. Proud to say that our local internet service has been able to support not only my everyday internet needs for meetings 10 hours a day at the lots of times, but also I had 2 children and a daughter-in-law that worked out of our ranch for a little over 30 days. So it's been a great time to be together and reconnect. Just a couple things I'd like to highlight first. As many of you know, Secretary Perdue just recently got added to the coronavirus task force, so he is part of those meetings that the President and Vice President sponsor each day, and in representing agriculture and the feeding programs that the United States Department of Agriculture has across our United States. We've been very appreciative of the support and the contact that Governor Ricketts and his staff have had with USDA throughout this, as well as with the task force, and really appreciate being able to reach out and visit with them about some of the things we've been working on. One of those occasions to reach out and speak with Governor Ricketts was when we were having troubles with cases developing in livestock processing facilities. And as we know, the President declared food processing to be a critical infrastructure need early on in the virus battle. And as those viruses started showing up in those employees that worked at the packing plants, we had trouble with absenteeism, as well as people that stayed home because they were sick. And so we saw a dip in slaughter that was hard on Nebraska's livestock industry, as well as rest of America's livestock industry. But we're proud to say, by working together with states and people like Governor Ricketts, with FDA and with OSHA, we've been able to establish some protocols for those packing plants that take into account additional shielding in those plants, take into account masking, taking into account social distancing when appropriate, to be able to provide an environment there that we feel now, and many epidemiologists that have viewed these feel that the likelihood of community spread in a processing plant today is virtually nil, and definitely no greater than what you would have out in your in the normal community and going to the grocery store. During this time period, within my mission area, as well as many others, it's been business as usual for at least half of my nearly 13,000 employees. They're graders and inspectors and people that are at the ports, making sure that we're not bringing in pests or diseases. And so, and also here in Nebraska, there are people that work with wildlife services and other things that directly impact farmers. And so those employees have been working every day, and we've been proud of their service there. In addition to AMS and APHIS in my mission area, FSIS inspectors have been at work protecting food safety every day throughout ever since we started moving through this shelter in place. And we are proud to say that between the grading and the health inspections, there has been no plant that has had to slow their speed of work because of USDA services not being available. We've been able to keep all those services running. And of course, FSA has continued to work and service farmers' needs. Even though their offices were closed, they've been able to work virtually and schedule appointments via phone to get stuff done, including the upcoming CFAP payments that were announced a little over a week ago. As you know, those CFAP payments are direct payments to farmers and ranchers across our nation. They come in about 4 different buckets. One of them that is especially of interest to Nebraska farmers and ranchers is those traditional crops, corn, soybeans, and wheat. The other one that is very familiar to Nebraska is the livestock payments that are available, and dairy payments as well. And then the fourth one is specialty crop payments that are very important, and those specialty crop payments not only go to recognize the loss of price during the shutdown because of the loss of markets when restaurants and food service closed down, but also to farmers and ranchers that didn't get paid for produce they shipped or weren't able to harvest produce because of the loss of those marketplaces. The other thing that USDA is very involved in is feeding programs across America. And here in Nebraska, during the next 2 months from now until the end of June, we're going to deliver over 1 million pounds, valued at almost $1.3 million in value to Nebraska food banks for distribution to Nebraskans that need that extra boost during this time when they might not be employed or where they might need additional food assistance. And maybe just to wrap up and postpone any other comments for questions later is, we still are dedicated at USDA to staying on mission and to delivering to farmers and ranchers and all the related industries that rely on USDA our day-to-day services. And whether that be granting figuring out how to work from home or granting regulatory relief or doing extensions on some permitting that is crucial because we aren't able to conduct all of our business from a distance, but we stand committed to do that and live by Secretary Perdue's charge to us that we do right and feed everyone. So thank you, and thank you guys.
Thanks, Undersecretary. Tourism is the third largest industry here in Nebraska. Last year, in 2019, the receipts spent by tourists that came to Nebraska exceeded $3.5 billion for the first time and generated $228 million in state and local tax revenue. The tourism industry employs about 40,000 people here in Nebraska, and as you can imagine, tourism has been greatly impacted, as it has been across this entire nation and around the world, because of the coronavirus pandemic. But having said that, we've got John Ricketts here, who is the Executive Director of the Nebraska Tourism Commission, to talk about our 2020 passport and some of the things that we can do right here in Nebraska, especially as we're thinking about, we're past Memorial Day, summer travel season's begun. So John, you're going to tell us about some of the things we can do right here in our own state, right?
Absolutely.
All right.
Thank you, Governor. I just want to add a quick little sidebar to some of the figures that the governor mentioned. 2018 was actually the first time ever that visitor expenditures in Nebraska on a percentage basis actually outperformed the national average. We grew at about 5.4%. Nationally, it was about 4.1%. So we thought.
John, when did you start?
When did I start?
Yeah. Wasn't it about that time?
17. I started in 2017. So
Yeah, see,
this is the first full year of
Yeah,
campaign.
just saying.
Here we go. All right. And
I was trying to throw you a little bone there, John.
thank you, sir. And 2019 was actually the second year that we outpaced the national average. So coming into 2020, we were really on a roll, actually. And then COVID-19 happened. And I think the best way to describe that is the effects have been rapid, and I'll use the word devastating because they have. The Tourism Commission is funded by a 1% lodging tax. We get 1% off of any lodging figure that comes out, and recently we got our March figures, which is, understand, a while back now. And in March alone, our revenue off of that was about $254,000, which is down 59.3%, and I won't round it to 60% because that even makes it sound worse. But just to put that in perspective, that $254,000 of revenue to us at a 1% level actually reflects about $25.4 million in visitor spending for accommodations alone in 1 month. And then, because I think everybody understands that when somebody vacations, they spend more than just on lodging. They can spend it on a lot of other things: restaurants, events, attractions, museums, historic sites, spectator sports, outdoor recreation, and on and on. The things people do when they vacation. We've now worked with Dean Runyon Associates, who's done our economic impact studies for many, many years, and we estimate that visitor expenditures dropped about $152.6 million year over year in March. So that kind, everybody's been talking anecdotally about the impacts, and then we've been using these words devastating. That we've been able to hook some numbers onto it now to really define what we're dealing with moving forward. We're going to track that month to month. We're not going to project because there's so many variables out there, you really can't do it accurately. But I think it's good for us to know moving forward the challenges we face. So we're going to continue to do that. But rather than dealing with the things we can't control, those are in the past, we're looking forward to a recovery program, and I want to spend a little time talking about that today. Obviously, the relaxing of some of the directed health measures is going to help the tourism industry a lot. You heard about those last week. For example, the renowned Henry Doorly Zoo can open up with restrictions on Monday, as is the Lincoln Children's Zoo here, the Golden Spike's opening up. So those opportunities are going to be great because, yeah, there's a lot of pent-up demand out there. People want to go out and do things. So as we move into summer, as these things start, some attractions are open up, like I said, people are going to start moving. But I think it's important that you understand there's a lot of information out there now, and Destination Analyst is a research group that I've dealt with for years, and I watch their sentiment indicators that they watch, and what they're saying is that people should also understand that, quote, American travelers are continuing a slow march to feeling safe enough to actually hit the road. So this is going to be a gradual thing. Another interesting factoid is that, just a little over a third of the people out there right now are even comfortable with welcoming visitors into their communities. So there's some challenges ahead. It's going to be a pace, I think, driven by the individual person and their families and their friends and families, just about how quickly they want to adapt in these changes. But we know that a lot of people are going to travel by car. They're going to probably travel not as far distance from home. They're going to be traveling to visit friends and families. And that really, I think, bodes well for Nebraska. In fact, and this is something we monitor daily, the visits to visitnebraska.com, which is our website, where people are shopping, we're an indicator, and we're actually bucking the national trends fairly significantly. From March 1st to right now, we're up about 15% domestically, which means people from the United States proper visiting our website. And I just got off a call an hour ago with all the state travel directors, and some of the state travel directors and other places indicated that they were really down from 10 to 25%. So there's some indicators out there that as people begin to travel, Nebraska is going to be a place they're going to be looking for. And finally, I think we're really fortunate to have the Nebraska Passport Program. This program is in its 10th year. It's tremendously successful, so much so that we've actually had people calling our office asking, where's my passport? When is the program starting? So we can tell everybody that we're very happy and excited about the Passport Program. We'll start June 1st. Just so you know, in terms of pent-up demand, there is a lot of it out there. We've distributed over 20,000 of these guides, actually requested by people. People can get a passport at all of the stops. Most of the convention and visitor bureaus in the state have the passport, and we also have a passport app. If you're not familiar with what the Passport Program is, it's basically a way that we incent Nebraskans, and actually out-of-staters have picked up on it too, to travel the state, to visit businesses of all kinds, museums, attractions, all those kinds of things. The impact of it in 2019 was about $24 million, which is great. And that's going to be a good way for us to enter into this recovery aspect, because the Passport Program can all be done a la carte based on somebody's comfort level in going places. So we're really looking forward to that. We've also extended a little bit. We're going to go till October 31st this year. We've talked to all 70 of our passport stops this year, and only one has had to pull out. So know that the stops themselves are excited about it. The passporters, as we started to call them, are very excited about it, and we'll start opening them up on Monday. We're encouraging everybody, of course, to practice social distancing, wearing masks and things. And if you want to learn more about the passport program, it's just visit nebraskapassport.com. And there you can, catch up with any dates of operation, hours open, and those kinds of things. Or you can go to and just download the Nebraska Passport thing, and we're going to work to see if we can't get this tourism industry in Nebraska rocking and rolling again. So thank you very much.
Great, thank you, John. And I'm sorry, so again, where are people, if I wanted to get a passport, where would I get one?
You can go online and order one.
Go online and order one.
Or most of the stops have them themselves.
Or the stops have, or those 70 stops have them themselves.
Yep.
All right, great, we're good. Okay. Also, let's see, just on the category of wanted to say thanks to folks, CVS Pharmacies announced this morning that they are going to be setting up 7 sites in Lincoln and Omaha that will allow for testing. It'll be a self-swab by the customer. You have to go online at cvs.com to register starting tomorrow, but then you'll be able to go to those 7 locations for CVS in Lincoln and Omaha to be able to get that test. So we want to thank CVS for opening up those drive-through testing and be able to add to the amount of testing that we were doing here in the state of Nebraska. So thank you, CVS. So schedule, again, we've got our English language briefing tomorrow at 2 p.m. This afternoon at 5 p.m. Central Time, we've got our Spanish language briefing. We've got our last planned NET, Speaking of Nebraska, with Dennis Kellogg from 8:30 to 9:30 tonight. And then next week, I want to say, first of all, I want to say thank you to all the media who have been attending these weekday press briefings with regard to what we're doing to slow the spread of coronavirus. Next week, we're going to start going to 2 days a week. We're going to go on Mondays and Thursdays, same time, 2 p.m. Central Time, but just Mondays and Thursdays. And then Spanish language briefing will be once a week at 3 p.m. on Thursdays. So English language briefing, 2 o'clock Central Time, Monday, Thursday. Spanish language briefing, 3 p.m. Central Time. And with that, I'm going to go ahead and get into Q&A. So our first is from Aaron Hagerty at KMTV, and he would like an update on the long-term care facility summary data. So Dr. Anton, can you come up and give us the summary data on that, please?
So as of today, we have 478 residents in long-term care facilities that have tested positive, 356 staff members of long-term care facilities that have tested positive, 107 total facilities that have had residents or staff test positive. And we have 87 validated deaths today of long-term care residents. That leaves us with still 3 long-term care residents' deaths that have not been validated. I just want to correct what I said yesterday. I did not say that those long-term care resident deaths were included in our dashboard deaths, but they were included. So those deaths have always been included in the death or the DHHS dashboard, but now they're validated. 87 of those deaths are. So we've had a total of 87 out of 163 total deaths now. 87 of those deaths have been long-term care residents, for around 55% of our deaths accounted for by long-term care facility residents.
Thank you, Dr. Anton. And then Aaron has a couple of other questions. Earlier this week, we learned about 1,500 unemployed claims were flagged for potential fraud, and that DOL was planning to get through most of these by the end of the week. Do you have an update on the progress of this? And do you have an idea of how many of these flagged claims were indeed fraud? And is the Department of Labor planning on taking any additional steps to prevent unemployment fraud? And I will call our Labor Commissioner, John Albin, to come up and address those questions. John?
Thank you, Governor. And I also am pleased that you read it in advance, so I don't have to repeat it.
Don't have to repeat the question.
All right, sounds good. Yes, just by way of a little bit of background, anytime you see an increase in unemployment claims, whether it was Great Recession or the current one, you also see an influx of scamsters, there, I guess, for lack of a better description of them, who try and hack into the system and get benefits to which they are not entitled. We're part of a national association of state workforce agencies, all the unemployment agencies in all the states. We also communicate regularly with other states, particularly those that are using the same vendors we are, to identify particular fraud schemes that are pending at the moment. Based on some information that we got, we did block some claims at the start of this week. We promised we would try and get that list worked through by the end of the week. As of this morning, there were only 12 left that hadn't been resolved one way or the other. And those should be, the ones that are entitled to payment should be processed tomorrow to begin payment. They'll probably, with the payment process, they won't see their money probably till Monday or Tuesday, but we will get them paid starting tomorrow. So far, we've had about 27 confirmed cases of fraud that were involved in these particular claims, and 12 that are still pending that we still haven't determined one way or the other. We intend, we've been encouraged and warned by USDWell that we need to be vigilant about fraud, because there are a ton of fraud schemes out there. The Nigerian schemes that they've had, one of the claims that we were working last week, we're pretty sure is part of one of the Nigerian schemes. It was not in this group, but it was another one that got reported to us. So we're going to be running algorithms against the claims every week. One of the things that we've been working with our vendor for the last few days is, as we clear these claims, we don't want to block somebody again because of that, of the algorithm. So we're making sure that those claims should process again next week without any interruption, and we'll be working today and tomorrow to make sure that those payments for those that were entitled get processed.
John, you want to just give us the numbers? Do you have the updated numbers for this week?
Numbers for this week. We had 5,794 new claims this week, which is down just slightly, less than 1% from the 5,836 claims we had the week before. We had 59,528 continued weeks claimed, which is down just slightly from the 60,757 that were claimed the week before. And the current queue of claims that need to be worked, that haven't been worked, is at 10,306. And just to give you a number, our comparison on that, over the last 2 weeks ending May 16th and May 23rd, we received 11,630 new claims. So I feel quite confident we're on top of the issues and getting everything done. In terms of benefits, we paid out total benefits last week of $71,872,214.99. $17.8 million of that was regular UI. We've got 125 individuals definitely paid, and more coming on the PUC that we talked about last week. And the stimulus payments tend to dwarf everything else, but the stimulus payments for last week were $50.2 million.
Great, thank you very much, John, appreciate it. All right, so did anybody else wonder, how does Francis, what's the sign for algorithm? Because you had to do that twice. Oh, okay, you just spell it out. Okay, got it, okay. I'm like, how do you do algorithm? Okay. Andrew Ozaki, KETV. CHI Health St. Elizabeth says starting tomorrow, they will be able to process or able to test 3,000 COVID-19 tests a day within the 48-hour turnaround time. How soon will there be more collection sites, and how soon would you like to see that number get to 3,000 a day? Well, we're pushing very hard to get to 3,000 a day. Obviously, that's been our goal. So we are, and you heard about all the test sites we've got. Again, this is one of the reasons why we need people to get signed up. So we are pressing on toward reaching that goal of 3,000 tests a day being processed. And then Andrew also asked, how many tests have been done on symptomatic people and what has the positive rate. Don't have those numbers, Andrew, sorry on that one. And when would you like to see broadening of the criteria to get tested? Again, we were evaluating the criteria. We want to make sure that, again, we're prioritizing the appropriate people. We do that for obviously symptomatic people, people who are in healthcare, first responders, food processing. We've opened it up to people 65 years or older, and we'll be evaluating other openings up of that criteria as we go along. How many people have had multiple tests? As of Friday last week, we had 106 people who did get multiple tests. Taylor, additional questions?
Don Walton wants to know, what is UNMC telling you about the possibility of another surge, and when or how large that might be?
So Don Walton asks, when, from the Journal Star, is asking, what is UNMC talking about with regard to a possible surge and how large would it be? While that conversation has come up in our daily phone calls, UNMC hasn't made any sort of prediction about another surge. We've talked a little about what some of the things that might cause it are, but again, I think the idea of a second surge is really just based on looking at historical precedents and the fact that sometimes during the summer months that you see the virus slow down and then it picks up again in the winter months. We don't know if this virus is going to behave again that way, so there's really a lot of unknowns out there with regard to what would cause a second surge. So while there's been some high-level discussions on it, there really hasn't been any specific direction on what will be happening, other than the way we're going to be on top of this is testing and tracing, contact tracing. So again, why Test Nebraska is so important? Because testing people is going to be important to identifying people who are infected with coronavirus, getting them to isolate or quarantine, and then following up on the people they've been in contact with over the last 2 weeks and getting them to monitor their symptoms or quarantine. So this idea of testing and contact tracing is how we stay on top of any potential surge down the road in cases.
Bailey Bischoff has a couple of questions. She wants to know, will city parks be open for events in June?
Bailey Bischoff wants to know, will city parks be open for events in June? Last week we put out our guidance with regard to gatherings, and so they would be under the 25-person rule because there's no rated occupancy, and it would be, again, if they're city parks, that will be up to the local city to be able to monitor and determine whether or not those parks will be open.
She wants to know if the car show brings in 150 cars with one person per vehicle, is that kind of event advisable?
So Bailey wants to know if a car show brings in 150 cars with one person per event, is that going to be advisable? And again, we're really trying to avoid large groups, so I'd ask the organizers of that event to consult with their local public health director with regard to that. It depends on where they're going to be going. So for example, if they've got an indoor venue that's rated, they'll be able to fall under the 25% of rated occupancy, but really what they need to do is consult with their local public health department with regard to that event to get an idea of whether or not that's going to be something that's allowable under the DHM.
Alexander Stone is asking about hospitalizations in the Omaha area. She says they're going up and the percentage of beds in use is rising. At what point do the hospitals need to end elective surgeries?
So Alexander Stone is asking about hospitalization rates in Omaha, and that we saw an increase of about 21 hospitalizations from, see, what is today? Today's Thursday, from Tuesday to Wednesday, and that drove down the percentage of hospital beds available. I would point out that over the weekend, though, that hospitalization rate also increased, or decreased. We saw actually a decreased number of people in the hospital because of coronavirus over the weekend, and then it popped back up again a couple days ago or yesterday. And also, if you look at the data, the number of people who are on ventilators actually went down, and the number of people in ICU rooms actually stayed the same. So it stayed the same at 19 people in the ICU room and 41 people or 42 people that were on on ventilators. So you got to take a look at the complete picture with regard to those hospitalizations. The other thing is Dr. Antone has been talking with the chief medical officers of the hospital systems in Omaha. We really don't think elective surgeries is driving a lot of this. We think that it's actually other health conditions that people maybe have put off. Say you had a cardiac issue and you were putting off going to the hospital, but then it got so bad you couldn't put it off anymore, and then you're coming in. Well, obviously, we don't want to stop those people from coming into the hospital. So Dr. Antone is in daily contact with the folks in the hospital, the major hospital systems in Omaha. We continue to monitor the situation. But again, as you look at some of the things like ICU beds, the number of coronavirus ICU beds didn't change, even though the number of people who were hospitalized went up those 21. Okay, I think that's it for questions because Taylor walked off. Questions from the media here in the room?
Can you give us an update on cases and deaths among food
So Fred wants to know about cases and hospitalizations and, or did you say hospitalizations? What, hospitalizations? Because I think we got that data too. And fatalities in food processing. So Dr. Anton, can you come up with that, please?
As far as meat processing plants, I don't have the hospitalization data, but there's been a total of 2,985 confirmed cases secondary to the meat processing plant industry, 11 deaths. Oh, I do have the hospitalizations, 138 hospitalizations for those confirmed cases for the meat processing.
And then follow-up for Secretary Eyeball.
Secretary Ibach.
Repeat the question. Hi.
So those figures that we just heard are up considerably from, what was it, a week or two ago when you said 1,100, Governor? But you said that epidemiologists are now saying that it's as safe to work in a meat processing plant as to go to the grocery store. What's your source for that, and does that square with the data that we just heard?
So I think it squares with the data in a couple ways. First of all, we've had some.
Question, you just said that
the-
to me, you didn't do it.
Yeah, I did, didn't I? Oh, my goodness. Thank you. Thank goodness you're still here backing me up. So the question goes to how do you square the increase in positive tests in the meatpacking industry with the statement I made earlier about the shielding and the employee attention to employee safety that packing plants have been implemented and the safety that we view there. So the first way that I would square that is that we have had epidemiologists both privately for the meatpacking industry itself as well as experts from outside the meatpacking industry that have looked at that and really feel that the chance of community spread with employees that all have face masks on, as we know if you both have face masks on, your chance of spreading the infection is something like 1.5% or something that's really low. In addition to that, most of those employees also have face shields on. They also have shields around them if they're in a area where their duties are confined, like in the cutting rooms. And so in many ways, those employees are very segregated from each other within the packing industry. The other reason why you see the increase in cases in the packing industry, though, is because that's probably one of the most heavily tested areas within the worker segment. And it's also an area where within the people that are going to work every day that are getting segregated out as far as the numbers. We don't ask how many grocery store employees have tested positive or other segments of society that are out working. So, just like with any disease, the common flu, the common cold, the more you test, the more you're going to find those. And I think that's one of the reasons why we continue to see those numbers gain is because we continue to test those workers at a very high rate. And those workers have volunteered in many cases to be part of that testing.
Another question, if you don't mind, for Secretary. Do you have an idea of the value that has been lost through the past few months for the meat that hasn't been able to make it to shelves for livestock owners?
So we were very worried at the beginning. I'm not very, no, I'll get there. Okay, the question is the value that has been lost to farmers and ranchers across Nebraska and across the United States because of the slowdown in the packing industry. And so we haven't quantified that at this time. What we were really focused on and worried about when we first saw the slowdown, especially in the swine industry, that a number of those animals would get too big to be able to be harvested in the packing plants, and that farmers would have to euthanize them and lose all value for those animals. We have gratefully seen those farmers be able to slow down their rates of gain for some of those hogs. We've been able to see the packing plants build back up to capacity. Nebraska plants have done an excellent job in getting back up to capacity. So right now, nationwide and especially here in Nebraska, we're not looking at having near the number of hogs need to be euthanized that we were worried about. Yes, there was a backup in the price and a backup in the supply and a deterioration of the price. And part of that is quantified a little bit in how the CFAP payments were rolled out, because we're paying 80% of what we perceived the loss in value of those animals going to slaughter or to market during the January 15th to April 15th time frame. And then the other component of the payment within livestock is 30% of what we think the loss in value or the additional marketing costs for those animals that are going to be marketed the rest of the year that were in inventory during that April 15th to May 15th time period. And so it's not complete data, but it's a little bit of an estimate. Thank you.
Thank you, Secretary. Other questions? No other questions, really? Martha?
I am interested in what we know about infection rates among frontline workers such as grocery store clerks and delivery drivers and so forth. Do we have any numbers for that?
So the question was, is there information with regard to infection rates among grocery store clerks or truck drivers or anybody else? I'm not aware of any data, but Dr. Antone, are you aware of any data? And Dr. Antone's not aware of any data. So I think to the Secretary's point, with regard to the food processing industry, we have been testing and paying attention more there, but in other industries we really haven't. So we don't really have that data.
I have a question.
Yeah, Lee.
For the tourism, in regards to.
John, can you come up here?
You mentioned $152 million was lost. Can you kind of explain where that money
Repeat the question.
was lost from and what it goes to?
Okay,
What it would have gone to?
yeah, the question is related to if we did, in fact, drop that $152 million, what categories, what segments of the industry did that come from, and where would it have gone to? It's basically the same thing. We just finished that tool last week, so I can go back to Runyon and Associates and ask them. Understand that lodging, that first number, makes up about 20%-ish of total visitor expenditures. And I don't have that with me, but I can go back and give you a general idea of how those other categories fall out. I'm sure restaurants is as a larger part of it than lodging even is. And aggregate, yeah, that's the number, but I can get you some breakouts.
And then do you have an idea of where that money, if you lost it, what it would have gone to? Is that to payments or, that's money's coming in, correct?
Yeah, the question is, where would the money have gone to? That's basically visitor spending, and it's lost revenue to the businesses, the hotels, the restaurants, attractions, and all those kinds of things in the state.
Payroll or?
Any of the above, yeah. We good? Thank you.
Thank you, John. Fred?
A couple more questions for Secretary.
Secretary, you're back. You're popular. Come back.
And maybe I'll remember to repeat the question.
When President Trump signed the executive order on the meatpacking plants, it was widely described as requiring them to stay open, but obviously it didn't have that effect. So what is the legal effect of the order?
So the question is, what's the legal effect of the executive order that President Trump signed with regard to food processing, especially meat plants? And so the intent was to drive home that not only did we have, and the executive order refers to the Sunday guidance that I refer to as the Sunday guidance because I think it was released on Sunday, the 25th of April or something like that, that was the summation of work done by FDA, by OSHA, and by USDA to assess what safety precautions needed to be in place to be able to help protect employees that were at those facilities, and in a way also that recognized that the food industry was a critical infrastructure. And it actually provided a great framework for us to be able to work with local and state health officials. In many cases, local and state health officials recognized that there was a national guidance out there for us to measure packing plants against. And those packing plants, the executive order wasn't that they had to stay open, that they had to comply with that guidance in order to stay open. And it helped us focus on that guidance rather than have 50 different state guidances or many more local health guidances out there to be able to follow to keep those plants open.
Well, that makes sense, but I thought the guidance was voluntary, that it was recommendations for.
So the EO said that if plants followed the guidance that was issued on April 25th, don't quote me on that date, but on that guidance, that provided the framework and the justification that they met what was considered by CDC, FDA, OSHA to be the premier guidance for packing plants to protect their employees.
So they're shielded from liability if they follow the voluntary guidelines, is that right?
Shielded from liability. EOs do not necessarily shield from liability. The fact that they are following federal guidance that's in place should shield them from liability, or should, in the case in Missouri where Triumph Foods was sued because they didn't think that they were providing what that some local people thought was the required safety measures. That judge in that case referred to the national guidance and said there is national guidance out, and as long as they're following that national guidance, it isn't a local concern.
Time for a couple more questions.
Is that for him or me? Thank you, Secretary. Martha?
So I have a couple of questions. This contract with Deloitte Touche, what are you paying them and where are you getting the money for that?
So we will be paying Deloitte & Touche up to $5 million based upon the services they provide, and that money will come out of the CARES Act money that is part of the administrative expenses to manage the over $1 billion that we're going to be using to respond to the virus.
Okay. And then you've talked about the Test Nebraska. How many tests were done yesterday or Tuesday?
So Martha asked, how many tests were done yesterday or Tuesday? So Dr. Antone, do you have how many swabs or how many tests returned we've had yesterday or Tuesday?
I don't have the actual number for yesterday, I just know the actual numbers for overall Test Nebraska, but not for yesterday.
We'll have to get back to you on those numbers for yesterday, Martha. We got the overall numbers. You want to just give me the overall numbers we got so far?
Sure.
You want to just come up here and do that? Yeah. Then we'll get back to you with regard to the numbers for yesterday and the day before.
So I think the governor mentioned earlier about the total number of assessments that have been done, over 350,000 assessments. That includes people that have signed up initially and then reassessed themselves on the website. There's been over 153,000 unique assessments, so unique individuals, 153,000. There's been a total of 25,141 appointments scheduled and a total of 18,412 total tests performed up until yesterday, or test results returned up until yesterday. And of those, 596 have been positive for around a 3.2% positivity rate for Test Nebraska. Turnaround time now is down to 2.2 days.
So the results were 18,412?
Yes, those are the number of results that have been returned to patients.
Okay, so how far are we from the 3,000 a day goal that
So
we were
the
hoping
number
for
for
by the end?
yesterday is 1,694 people were swabbed.
Okay, so 1,694 tests were done yesterday. Swabs were done yesterday. And we're getting up there. It's getting close.
So that's about half,
A little over half, yes.
a little over half, but I thought the goal was to get to 3,000 by the end of this month. And this seems like we're a ways from that.
But we're getting closer. We're very, very close. We're a lot better than we were in the initial part of Test Nebraska, so we're getting very close to that 3,000 a day.
Thank you very much, Dr. Andrew.
Why we're not at the 3,000?
So again, Martha, the goal of getting to 3,000 tests per day is about increasing the testing here in the state. So we're not at our goal yet. We're continuing to push the team to be able to get there. But it's also nearly 1,700 tests yesterday that we wouldn't have had otherwise. And so that's a good thing for the state that we've got more tests that are coming in. And just like any startup business, we're finding things that we can improve upon, so we're continuing to work on that. And again, this is why we need to be able to expand the number of people who signed up. And one of the things also is when we send teams to places like Clay Center, which we did this week, we need to go to rural parts of our state. We can't ignore our rural parts of the state. We can't just stay in Lincoln and Omaha. We got 68 swabs out of Clay Center. So when we go to smaller rural towns, we're not going to be able to get 500 tests because there just aren't that many people that are going to be signing up and doing it. So, but we are working to get to that 3,000 tests per day. We want to make sure that we've got that robust testing and people can get access to it. So we're going to continue to work with the team to be able to get to those 3,000 tests a day. But even improving upon where we were when we started to get additional, 1,700 tests a day or 18,000 tests that were returned back, that's still really good. I mean, let's think about May, right? So we started May with a total of like 27,500 tests, and now we're over 90,000. Well, okay, so let's just do the quick math there. Say 30,000 to 90,000 is about a little over 62,000 tests we've done so far through the month of May, and 18,000 have been Test Nebraska. That's a good chunk of them. So that's pretty good. I mean, we want to get to the 3,000, don't get me wrong. We want to keep pushing this. But Test Nebraska has really helped us expand our testing.
Time for a last question.
One last question. Yeah, Lee.
Monday is the new rule, and we saw over Memorial Day pictures from around the country where gatherings were just exceeding any number of rational group limits. And the Nebraska Game and Parks is the ones that oversee some of these larger lakes around the state where maybe gatherings start to come. What is your process in trying to advise them maybe not to let certain things happen, but let them also make their own decisions because that is their department?
Yeah, so Lee's question was, obviously over the Memorial Day weekend, we saw places like down in the Ozarks where they had large gatherings where they're not social distancing. We saw the story about here in Nebraska at the Surfside Club, same sort of deal where they weren't following the social distancing guidelines. And Game and Parks is obviously responsible for our lakes here in the state of Nebraska. And what's the process for the governor's office to work with Game and Parks? Remembering that Game and Parks is actually an independent agency, so they don't report to me. They are run by a board of commissioners, and so that's who the authority for that is. But with regard to what they're doing when they think about how they're allowing people to come in and use their campgrounds and so forth, the commissioners there are making that decision. But I have conversations with them where I'm talking to them about what they're thinking about. I know I've encouraged them to talk to the local public health directors, and they're talking to the local public health directors about, for example, the lakes that may be available in their area. So it really is a dialogue with regard to them where we give them advice. I would say there's not a formal process per se, but we pick up the phone and we call each other and we talk, and I encourage them to work with the local public health directors to be able to make sure they work that all out. Well, again, folks, thank you very much. I appreciate it. We will be here at 5 p.m. Central Time for the Spanish language briefing, 2 o'clock tomorrow for English language. Next week, Monday, Thursday, 2 p.m. Central Time for English language briefings, 5 p.m. Thursday for the Spanish language briefings. And again, I want to thank all the Nebraskans who are working to keep Nebraska safe by following our rules, paying attention to the guidelines, keeping that 6-foot distance when you're in public. don't go to groups bigger than 10 this weekend, right? We're going to go to the 25 people next group. John, you're standing in front of a camera. John, geez, I invite you, and all of a sudden as soon as we're done, you're like trying to take off on me here. See, Fred, I call anybody out on this. So I want to thank everybody who's paying attention to those rules and helping us follow those guidelines. Kind of to Lee's question, look, folks, if you want to be able to return to a more normal life, we have to follow the guidelines. We got to avoid large groups. Wash your hands often. Wear a mask in public is always going to be a good idea. So please follow those rules, and that will help us be able to loosen these restrictions and return to a more normal life. Thank you all again, and we'll see you back here tomorrow at 2 o'clock.